Okay, so let's talk a little bit about health news. They say use it or lose it really applies to your mind, especially when it comes to engaging your senses.
Yeah, research shows hearing loss in older people is estimated to account for nearly 10% of dementia cases. Now mounting research also linking vision loss to the development of dementia.
It's an interesting connection. We're going to bring in Dr. Frank McGeorge to kind of explain exactly how they're connected and what we can do about it.
Well, you know, Karen and Devin, as we age, many of our senses can become dulled, and often people just accept it as a normal part of aging. The thing is, we can correct most of those problems, whether it's through the use of hearing aids or other assistive devices. Research indicates, if untreated, loss of these senses leads to loss of mental function.
A recent study from the University of Michigan, published in JAMA Ophthalmology, looked at the association between visual impairment and dementia. Dr. Olivia Killeen is the lead author.
Vision problems really matter because they impact every aspect of a person's life. They impact their ability to work, how they can enjoy leisure time with their friends and family, and even more profoundly, vision problems are linked to a number of other negative health outcomes. People with vision problems are more likely to have depression, dementia, anxiety, falls where they hurt themselves, and even early death.
The study identified that among the nearly 3,000 participants with an average age of 77, just over 12% had dementia. But in people who had trouble seeing up close, 22% had dementia. Moreover, for people with moderate to severe distance vision impairment or blindness, the rate of dementia increased to 33%. This study doesn't prove vision impairment causes dementia, but it suggests improving older people's vision might be a strategy to slow cognitive decline.
In our culture, sometimes there's a perception that losing your vision is a normal part of aging, but it's actually not. We lose vision as we get older because of eye problems, most of which can be treated. Simply needing glasses or cataract surgery are two of the biggest reasons we may lose vision as we get older, and those are completely treatable.
Now, there's also other research that shows lower rates of dementia in people who had their distance vision restored after cataract surgery. So the link between vision and dementia is certainly plausible.
And this is really interesting because you have talked before about a loss of smell maybe being a harbinger of dementia coming. So is there any way then to sort of use that knowledge to help hold it off?
So it's a really interesting question, and the answer is sort of. So smell, of course, is different from vision and hearing because we don't really have a way to assist a person's smell like glasses or hearing aids, but we do know smell is powerfully linked to memory, and there is, in fact, research using smells, or essentially aromatherapy, to enhance memory and cognition in people with dementia, and it has shown promise.
Olfactory memories, for a lot of people, are
so
so
strong.
powerful, right?
Smell
something and it brings it right back.
to it.
Sure.
Yeah, fascinating. All right, Doc.